the activities, but it's always nice to accept money, especially at this point in time with our life where we're spending money like crazy. So that's what I'm looking for, to accept this money.
Any questions for Jack?
Is there any kind of a match requirement?
Nope, no match.
Okay.
Any questions? Any other questions? Motion to approve?
Yeah.
Abuse.
Abuse,
Second.
I'll second.
All in favor?
Whoever.
Aye.
Aye.
Aye. Opposed? So carried.
That's it for Jack, unless Jack has to report on whatever he wants to report on, but that's all he submitted.
Jack, do you have anything you want to report to the committee, or is there any questions from the committee to Jack?
Well, that's what I figured I would handle the questions. We, continue. You can see with our daily totals, we're up to 354 on our positives. We have 19 people in the hospital. Interestingly enough, 15 of them are Barnwell people. 15 out of 19. They've been sending them to Albany Med, St. Peter's, and Columbia Memorial Hospital. We did get reports of an individual went earlier today from somebody in the emergency department who questioned why they sent this person. This person was so close to death that they didn't understand why they didn't just let him die in place. I think that the home is trying to avoid. I think there's a tale of two nursing homes here. There's Pine Haven that still has more deaths associated with it, but they own their deaths from the beginning. They were aggressive in their testings. They mourned their people that they lost. And then there's Barnwell that's trying to avoid any kind of association with the folks that are dying in their home. And to the point where last week they were reportedly telling the rescue squad people the addresses, the home addresses of these people, rather than acknowledging that they were Barnwell people. I think it's very bothersome behavior for me. I find it very bothersome. We are gelling up our two sites in Hudson for our clinics. Seems to be moving along pretty well. People are registering now. Not registering. Interestingly enough, as of this morning, we had 12 people registered for the 27th, and none of them were Hudson residents. People are registering from as far away as Hillsdale. So it's interesting. I just didn't expect that. So I expected more Hudson residents. I expected sort of a mixed bag between folks that might be up here from the city and it was a second place or whatever, and also people from down the Hudson proper who have been here all along, long-time residents. But I didn't expect this bunch of people that are coming in from outside the city. So it should be interesting to see what happens.
Jack, the question there, are they going to have to, they're driving in, so they get out of park their car somewhere and then walk up?
Yeah, and that's part of the reason why we did, John L. We were going to do walk up, drive up, but we've decided to make it walk up. But if you're driving in, you got to get out of your car and walk up. So I mean, it's nice open space and whatever, and we can do that. We can accommodate that.
Jack, are we going to keep track of asymptomatics in this? If we do have any that sign up, keep track of the fact that if someone is positive but they're asymptomatic, we're going to keep track of that, correct?
Yes.
Okay, great.
Yeah, and as a matter of fact, we're kind of in negotiations right now with Columbia Memorial to see if we can set up more or less a permanent clinic, let's say twice a week at their Valatia and Copic Rapid Care, where from 10 to 2, anybody who wants to be tested can come in. We would provide the tests, and they could just administer the test. We can pre-register people for them, and so that way we have a permanent thing, a permanent way for people to get tested. And we would also that's a way for us to reach a lot of those non-symptomatic people.
Any other questions for Jack?
Can I make a statement?
Hi, Jack. How many people died so far in the Columbia County?
28 as of today. 28 people as of today.
I have any Hudson, any people?
Hospitalized right now, it's 19.
Okay.
And the permanent clinic that you're referring to,
would this be a free clinic or would this be a clinic that requires insurance?
As long as we can, what the tendency across the region anyway, I don't know about the rest of the state, but the tendency across the region is that a lot of these drive-up clinics, walk-up clinics are only getting 30, 40 people a day, kind of thing. So what we expect is that as long as we get that amount, we can send them to Wadsworth. Wadsworth is the only free lab because it's a state-run lab, or essentially the state is paying for the test. So as long as we can pull 30, 40 people a day or less, and if we get 15, we send them to Wadsworth. It's going to be free, and we don't have to do the insurance thing.
Thank you.
Brenda, don't forget also that anybody that wants to get a test without an appointment can go to Well Now in Hudson, and you don't need an appointment, and they're doing both molecular tests as well as antibody tests. So if you have insurance, it's free. If you don't, they charge a fee, but you can go there anytime if, in fact, one of these clinics does not work for them.
And the SUNY Albany site is also still open, and that's free. That's the swab test. They're sending their results over to Wadsworth as well.
Kathy, you had a question. Are you still on? I thought I saw where she left. Okay.
Kathy said she wanted to make a statement.
She did, but I
She did.
said that she left the meeting. I guess that was her statement.
She might have hit the wrong button.
Those buttons are right next to the mute button is the hang up button on this
Right.
phone. So
I found out a few minutes
I'll
ago.
be back.
Okay, any other questions for Jack? If Patsy comes back on, we'll.
Yeah,
Chairman,
question.
Linda, go ahead.
I have a question. So Jack, just explain this once more. If someone passes away, dies in Barnwell, they're not saying they've died there?
Yeah, there's a report called the NORA report, which is supposed to be sent in every day, and for some reason they hadn't sent their Barnwell hadn't sent theirs in, and on Friday they finally sent it in, and they reported one death, and this is the one person that, and I did have a conversation with the administrator of the home, a week or so ago, because he said, I don't understand your data. He said, we only had one death in the home. I said, you can't disown people. When you send them to Columbia Memorial, before this thing started, they would send people to Columbia Memorial and they would get better and they would come home. They would come back to Pine Haven or Barnwell or wherever they were from. I said, you can't disown these people just because you send them to another, into a hospital. And that's what they were trying to do. They were trying to disown it. So because they didn't want the negative publicity, I guess, of the deaths. But again, Pine Haven didn't do that. They owned it, and they just didn't draw the attention that Barnwell's drawing.
So do we have,
We're
I'm
not
sorry,
going to get away with it.
Go ahead, Brenda.
thank you. I'm on the phone, so I can't see anybody. Have we had any updates from Whittier? Have they eventually complied with a report, any kind of a report?
Well, Whittier, but we did find out when we got when Chairman Morrell got the request to see if we wanted to test all the nursing homes in the county. My first question at the time, and it was not answered by state DOH, was, is there any entity, the state or us, that can mandate the testing? And what we did subsequently find out was no, nobody can mandate that they test. And so Whittier has not tested residents. Now, at one point, Rob put out a press release and they responded to the press release and they said, well, wait a minute, we've had 22 people tested. Well, the 22 people that were tested were people that were sent to the hospital, and the hospital's policy is, if you come through the door and you're going to be admitted, we're testing you for COVID-19. I think maybe 2 people were tested in the home and the rest of them were tested at the hospital. So it's a little bit of a shell game. So no, they haven't tested their residents. They haven't done mass testing at their residents like everybody, all the other nursing homes in the county. Interestingly enough, I had a conversation yesterday with my counterpart in Montgomery County, and she has a nursing home in her county that's also owned by the same company, and they're doing the same thing there. This is a corporate decision. They're not testing their residents. This is not just a local thing. They're not going to test their residents until they're symptomatic. Well, as we know, 80% of the people out there might not be symptomatic and that might still be carrying it. We are still getting tests some of the staff from Whittier are going, and they're getting tested, and they do have positive staff. And I kind of believe if they've got positive staff, they've got positive residents.
So the Whittier staff is being tested independently of Whittier?
Well, now, of course, this week, starting this week, all the nursing homes in the state were supposed to test their staff. I think a lot of them are having, and understandably, a lot of them are having a hard time coming up with labs that will take the results and whatever. And I suspect the state may back off on that. Whittier did something that I thought was a little unscrupulous, and that was on Friday. We got an email from an individual who works there, who sent us a copy of a flyer, a letter that she got walking in the door that said, you need to sign off on this waiver, and it indicates that you do not wish to be tested for the COVID virus. And if there is any testing, you do it on your own. And if you don't sign off on this, you will be terminated. I think that's horrendous. That's a horrendous thing to do to people. I mean, this particular person was an LPN. They don't make a ton of money, and now the state wants twice a week testing. Is the facility putting it on them, on the employees to test? It's just a horrendous thing to do. So I've lost a lot of respect for the folks that own nursing homes in this county as we go through this.
Anyone else? Jack,
I have a question.
go ahead, Sarah.
And I know I've talked to Patsy about this too. Particularly at Barnwell, on Facebook we hear that there's nobody taking care of the patients. They're sitting there unclean in their beds and stuff. And maybe the state has been in, maybe not. How do we get in to find out the truth?
Well, they have been in supposedly. Patsy insisted that they go in, and they did send a team in last week. And they according to what I've heard, they found nothing that was reported by the two hospital staff that were in there just a couple of days before that.
But we don't know if they looked at every person.
We don't know. We don't know if they were taking select areas. What we do know is that there are certain sections of floors that have not been tested for the virus. And I think that they've stopped testing because they just don't want any more positives. They don't want any more numbers. And, to date, they've had 40 staff affected by the virus. Now, some of the folks that were positive earlier on are probably coming back to work now. But nonetheless, they have 40 staff that are affected. I got to believe it's affected the quality of service. It has to.
Is this something that we need to be thinking about for day two? Once we get this more or less behind us, do we need to be thinking about what additional supervision or support we'd like to see from the staff with regard to, from the state with regard to nursing homes? It seems that this is uneven and hard to predict. And this is, and if I understand you, Jack, correctly, you said this is these facilities are under the State Department of Health, not under the County Department of Health.
Correct.
Correct. There's a regulatory unit within the State Department of Health that governs them.
So I'm just wondering if at some point, Rob, this is something we need to consider in terms of a communication to the Department of Health that just basically is an analysis of our experience and talks about lessons learned and how to do things better in the event that this were to occur again.
So, Jack has been in contact, and obviously the health department has in constant contact. And it might be something that if it came from us as a committee and as a county, in addition to what Jack's been doing, that might not be a bad idea to put a letter together to the state in reference to our experience and how this has gone when this is over. So I think that we could do something like that. I think that's a good idea.
I will say that I've made the governor's office aware of the situation on a couple of occasions, once directly with our rep and also with the control room of the capital region. I brought the concerns about Barnwell and some of the nursing home issues to them as well.
And I think one of the conversations Matt had, we got some reaction immediately from it. So there has been constant through the health department, through Matt, to them, but it wouldn't hurt to send another letter from our committee for sure.
Yep.
I think it would be good.
I think in some respects, you're talking, in a very real respect, you're talking about legislation that, why couldn't the state health, Department of Health mandate that these folks test their residents? And I think I agree that the county government itself could take a step here, and that is contact lawmakers and say, we need some new legislation here. We need some new regulations to govern this.
Yep, for sure.
Facilities should be forced to test.
Any other questions for Jack?
Okay, Rob, I'm not on the committee, but can I ask a quick question of Jack?
Go ahead.
So it seems like we're doing a lot more, open testing clinics, which is wonderful to see. Is it safe to then make the assumption that the state has been better at getting us the tests that we're needing, or is this just because of those private donations and the purchases that we were able to make?
We have received 200 test kits from the state of New York to date.
To date?
200. To date, 200. So no, it's safe to say that it's only the private donations that are driving this. Columbia and Greene counties were kind of left out of the loop when it comes to testing sites. Now, did we take advantage of the ones in Dutchess County and Ulster? Do we continue to take advantage of the one at Albany, at SUNY Albany? Yes, but we've been left out of the loop when it comes
We're
to
giving test kits, Jack, correct? That we gave we were directed to give right to the nursing homes, correct?
Yes.
That was an addition, but they were not for us.
Now, yes, and now as of last week, we got 1,080 kits that we were told we could use for any way we wanted to use them for, but we pushed a lot of them out to the nursing homes because they're under this mandate to test their staff.
Right.
So that's the first big batch of test kits we finally got, but up until last Friday, we had 200 kits total.
So Rob, can I ask, would it be appropriate for either this committee, which I'm not on, or the full Board of Supervisors to write not just our state representatives, but our federal representatives, because obviously the state is also having the same issue we as a county are having, where they're requesting test kits from the federal government and only getting a smaller amount than they need. Is it something that I could help draft a letter, or something where we could, petition to our higher elected representatives, both on a state and federal level, to get us more test kits, especially as we have these testing requirements as businesses open up?
I mean, I don't see any reason why we couldn't do that. Matt, do you see any reason why we couldn't do that?
No, I think that's not a problem.
Yeah.
Do you want me to draft something and send it to you and Matt, and then you can revise it from there?
That'd be fine. Thank you.
Okay.
I will say this. I think we've moved past the phase of the nasal swab. I think most people out there that want to get tested want to get the antibody test. The committee, the county, Matt and Rob and the folks that talk at 11 o'clock, we're looking at buying antibody kits now. We're moving into that phase.
Okay.
But at the same time, the nasal swab diagnosed if somebody is currently able to pass the virus on. And so I do think that we're going to be testing for the rest of the year. We're going to be testing. That's why I want to try to set up those standing clinics with CMH, because I think we're going to be testing the rest of the year. We're going to be using swabs, but I think the bulk of the people out there want that antibody test at this point.
I mean, the county's been incredibly proactive in reference to purchasing our own test kits, regardless of whether it was donations or not, because the county also put up money for these test kits. It wasn't just donations. And it's a misconception that we only bought them because of donations. We bought them with donations because people wanted to get involved, which was terrific. Matt's led the charge with that in reference to finding funding. So that's been great. And we have done that. So it's been a good effort on our part, but for sure we haven't gotten enough help from both the state and federal government. Patsy, I think you're on and you wanted to say something?
Got to unmute yourself, Patsy.
Okay, well.
She was in on her phone, so I don't know what happened, but
I think
she texted me.
That's her statement. I think that's.
Does anybody else have any other questions? Jack, just on behalf of the community, I just would like to say thank you very much to you and your staff. We really appreciate the extra effort and all the hard work that you've done and the staff has done. I mean, you all should be commended. So thank you very much for that. And Michael, you had another thing to say?
Yeah, I was just wondering, as we're entering phase one, how are we thinking about sort of testing or the increased risks as we, we've had some successes of flattening the curve in the county, and that's amazing, but we're sort of increasing the risk as we open up. And I'm wondering sort of what is our public health strategy going forward?
Who?
Yeah, you were asking, Jack, are you there?
I guess
I'm
yeah,
here.
Jack.
Well, I think that's Matt's question. I think that we're talking about the reopening. I think we're talking about the committee that you have. We've got two committees. Rob Lagonia heads the one with the county workers and the county offices, and Michael Tucker is involved with the other committee. So we're looking at both of those things.
I will say that there are specific reopening plans for businesses, Supervisor Chimides. And, in terms of within their plans, they have to address the social distancing, and how they're going to keep employees safe, how they're going to keep the public safe. They also have to do an affirmation to be able to conduct business once, you just can't open up tomorrow. They're going to have to do some things to be able to open up, which I just was going through today. So there are steps. I mean, from the county employees' perspective, as Jack said, Supervisor Lagonia has a committee that they're working on opening up the county. There are also discussions about making testing available to county employees, antibody testing to see if they've had the virus in the past. And we're doing a lot in terms of county buildings, cleaning protocols, plexiglass in front of it. Like in DMV's a real example where we have a lot of public, there's plexiglass. I know DSS is taking steps. So there's a lot going on in preparation for us to be able to open and for businesses to be able to open. But
yeah, to add to Matt's, there is a lot going on, Michael. I mean, my committee's meeting on Thursday. Michael Reardon's been great. The whole committee that I have has been great. Brian has been putting signs together. We've upped our PPE. We've been stockpiling it. We purchased a bunch of thermometers, so we'll be doing that. That'll be part of the protocol for coming back. And the plan is also not to just bring everybody back at once. It'll be a slow grind. We'll figure out the departments that need to come back right away. Those that are being productive and working at home will continue with that. Because we may have to adjust this plan as we move forward. We're going to have to see how that goes. But I think I can't say that we're perfect by any means. I don't think anybody is, but I think we're addressing as many things as we can. We sent out a poll to all of the department heads. We're going to put all that information together. We're going to put a plan together, and then we're going to have to adjust it as we go. So that's the plan at this point. The antibody tests that we were planning to order, unless that changed, that wasn't on the call today, they would be a finger prick. So that would be something that if we had employees that were interested in antibody testing, we'd be able to do that. We were purchasing enough of them for that purpose. So in addition to the other things we were doing, we would also have that in our back pocket. So I don't know if that answers your questions, Michael.
That is. Thank you.
You hear me?
Yeah, okay, Patsy, go ahead.
Patsy.
Finally. Oh my God. Don't ask me to do this computer crap. Sorry. So listen, I want to give you guys some updates that I have dealt with within the last couple days with Barnwell, the Grand. I'm going to call it the Un-Grand. Nobody has any idea what the residents are going through. There is a nurse that is going to be on Channel 5 News tonight on Channel 10 at 5 o'clock. And even if she loses her job, she's willing to do an interview because the conditions that they have to work under. I've also have found out from family members that there is employees there that can't afford to lose their job or leave their job. The husband's quarantined and they have the virus and they can't afford to leave the job. They have not been tested at all, but they know they have it. It's a mild case, they said. People in the area also are afraid to go by there, and family members, and the phones are not being answered. They're not being told the truth. And I'm telling you right now, they're blowing smoke up our you know what. and I told the owners of the Grand that, and Jack has been very supportive of my Irish ways that I've been trying to deal with this. But when I hear the community people that can't find their parents and their employees or their family members that work there and what they're going under, there's people that work there that are very brown noses to the corporation that owns the building. And that is also sad. They're also told not to say anything. They also are told to cover up. You do not repeat anything. You will lose your job. And there has been people that have lost their job because of what they've said to the people in administration and so forth. But it's a serious thing. I called the state 3 times today, Jack, and that number that woman didn't realize that I know what caller ID is from the government action group with the state health department. I think they need to be there every day and not just come in and do a visit. And I don't think they're going to the proper places in the building. I think there's a cover up and there is not enough staff, and we have to realize that. So, I mean, I had enough. Anybody want to change towns? Like, come over here. I'll take your town. I'll give you a case of toilet paper to go with it, you know. But I just have to give you a update. I mean, I have 2 issues here in the town of Kinderhook, and I'm trying to deal with both of them at the same time. But Barnwell was always the biggest employee I had here in the town, but it was family. It was a place where families always knew to go to, and it was okay to work there, okay to have your family there, and it's not anymore. And people, the elderly, are scared around here. The neighbors are scared, and so forth. So I think we need to tell the state to get down here every day and do what they have to do. And I don't care what they have to do, but you know, we have to do something. So I just had to say that and speak my piece like I usually do.
Well, thank you. And I'm sorry that you have to deal with that 2 things in your town, but we're glad you have a big mouth. So, and I didn't mean that disrespectfully.
There's a couple of people that aren't very happy about it, but you know, unless you speak up, somebody has to be heard. And unfortunately, I'm doing it for the people, not just because I have a big mouth. It's just because I know I have to care. So, but let's keep it going. We have to get that state in here or somebody in here. All right.
Thank you. Any other questions for Jack? Otherwise, I'd like to move on to Michael. Thank you, Jack.
All right, thank you.
Okay, Michael, you're up.
Can you hear me?
We can.
It's normally tough following Jack, but during a pandemic, this is tough. Thank you, Jack, for all your work. I have 2 financial resolution requests. I don't know if you want to pull them up, Kelly. Authorization to modify the mental health. I'm sorry?
I said they're up.
They're on the screen, Michael. You can't see them?
Oh, okay. I must be.
I see it.
The first one has to do with authorizing modification of the Mental Health Association 2020 contract upward. They are on the verge of transferring assets and liabilities from the Philmont Hearth to the Mental Health Association of Columbia and Greene County. This has been in the works for almost 2 years. The State Office of Mental Health has approved it. Both organizations' boards have approved it. Our Community Services Board has approved it. We're almost ready to go. So there is some aid that passes through to the Philmont Hearth that will now go to the Mental Health Association. There's no net change. It's just who's getting the funding.
Any questions for Michael?
I'll move that.
Can I just ask, can I ask about liabilities? I see here that we're getting assets. What about the liabilities?
The Mental Health Association is assuming whatever liabilities come with it. I don't know the specifics of that, Chairman. We are not. The county is not.
We don't know. We don't know if the liabilities exceed the amount of the value of the assets.
I don't know the particulars of the transaction. This serves the needs of the community, and the Mental Health Association is very comfortable with this, whatever the finances are. I have no concerns that this will jeopardize the Mental Health Association's financial position at all. I haven't heard anything to that effect.
So this is all state aid, Michael?
The Philmont Hearth receives a combination of state aid and federal salary share funding from Columbia County. The state aid is 100% pass through, and there's a small amount of federal salary share also.
So there's no local tax dollars, county tax dollars?
That is correct.
Can I jump in here, Matt?
Yeah.
Ron? Yeah, there's no liability to the assets. This is 100% pass through for the county. We're not really assuming the assets or liability. It's really the pass through of the Mental Health Association for both Greene County and Columbia County. We're just a conduit of funding. That's it.
Thank you, Ron.
Okay.
Thanks, Ron.
I'll second it.
Okay, first was Matt, right?
Yeah.
Need a second, please?
Robert Bury, second.
All in favor?
Aye.
Opposed? So carried.
Aye.
The second financial resolution request is to update provider contracts to include 2020 approved COLAs. Again, this is 100% pass through. We, on a somewhat regular basis, have to amend the contracts to reflect increases that we receive that we must pass through to our contract agencies that are reflective of COLAs being approved at the state level.
This is an annual thing. We do this every year with the increases in COLA. We just adjust the budget accordingly. That's it.
Thank you, Ron. Any questions for Michael or Ron?
No.
Motion to approve?
I'll make it. Bury.
Second?
Second, Sterling.
All in favor?
Aye.
Aye.
Opposed? So carried.
I do not have any personnel resolution requests this month. However, I need to inform you that yet another one of our staff resigned to take a position with the city of Hudson. That brings year to date the number to 8. We have a total of 10 vacancies. 8 of them have to do with individuals retiring or resigning. So we are very vulnerable, and I'll discuss that later. General resolution requests, we have 2. The first one is authorization for our department to recontract with Better Health Northeast New York, which is a performing provider partnership. They have suspended the reporting and have changed the performance metrics as a result of COVID-19. Our contract totals remain the same, but the timeline of when we're eligible for those payments is pushed out into the future about 6 months. And some of the performance metrics have been made less difficult to accomplish, or I should say, we're able to accomplish them providing digital healthcare.
Motion? Any questions for Michael on this?
I'll move it.
Second?
I'll second
Patsy.
Sterling.
Stelling, second. All in favor?
Aye.
Opposed? So carried.
Okay, the context for the second general resolution request is that unfortunately I had to terminate the contract of a part-time consulting psychiatrist late last week. That individual was working 14 hours a week and had a significant caseload. And I'm requesting that a consulting psychiatric nurse practitioner that we currently have, who is available to have her hours increased by 3.5 hours a week, be permitted to permit her to work 21 hours a week on a consulting basis to help us absorb the caseload of losing that time that was offered by the consulting psychiatrist.
Is this a temporary or a change or a permanent one?
A permanent one.
So we would still be short 11 hours a week?
That's correct. I'm trying to be very careful. And obviously, the furlough plays into this. But again, I'd like to have that discussion later if it's possible.
Okay.
Yeah.
Any other questions for Michael on this? Motion to approve?
Motion.
Aye.
Second?
Sterling.
Sterling, second. All in favor?
Aye.
Opposed? So carried.
Okay, we do not have an overtime report this month, but I wanted to move into other topics that I'd like to discuss with you. The first one is just to let you know that we are being proactive with our vendor partners, our not-for-profits who receive state aid to localities in anticipation of some level of cuts, dependent on the federal relief package and the pace of our economic recovery. It is pretty much the consensus that some sort of cut will be announced, and the localities, we hope, will have input as to where those cuts can be made. So I tried to be proactive with the executive directors of the contract agencies who receive aid to localities from us, and requested that they submit proposals for a 20% reduced state aid and what the service impact would be of the 20% reduction. I don't have any more knowledge than you do or anyone else does about what the percentage of the cuts will be. I just did it as an exercise to make sure that they, to the extent possible, they had control over where the cuts would be made to minimize the service impact and the impact to their employees. So I have received those. I will be at the point when we get news from the state offices on what level the cuts will be. I will then present the proposal to the Community Services Board, and we may have to modify it upwards or downwards. So I just wanted to let you know that is underway.
Okay.
Any questions about that?
Chairman Ligonia, let me just jump in here. These are, again, the pass-through agencies that we're talking about. We have quite a few of them. But just to let the committee know, we've already made the decision that we're not upfronting any of these agencies' requests for funding until we get the funding from the state ourselves. So we don't want to be in a position of county of funding any request before we get money in through a cash flow. So we're watching that very closely on these requests that come through.
Thank you, Ron. Any other questions on the number one? If not, we'll move on to number two.
School satellite clinics, the future of school satellite clinics, I have not received any feedback one way or another from any of our school districts concerning my request for a partnership in financial support of the school satellite clinics that we pre-COVID-19 had been operating. I know Supervisor Rory had started to work with the districts, but then we were slammed with COVID-19. I don't know the status of that. I don't think the school districts know what their state aid is going to be. So I do think we need to make a decision at some point what we plan to do in the fall, assuming that school districts reopen in the fall.
I do think, Michael, we have to have a larger discussion on that for sure, given that we don't know if schools are going to open, A, and B, if that's something that we are going to support as a board or not. So I don't know that we have enough time to discuss that now, but I think we do have to set some time aside for that, and it would probably have to take place next month. I don't think we can wait any longer. And Supervisor Berry, did you get anywhere with that, or I don't know where the status of that is?
At this point, Supervisor Lagonia, I drafted a letter and I turned it over to our subcommittee. And then that was just at the beginning of this whole process where we put on pause. And as we all know, the schools are also facing very heavy cuts to their budgeting. So I don't know for sure, but I would imagine that this is not going to be something that they're going to be wanting to pay for next year. But we should follow up next month.
Yeah.
Their budget vote is going to take place in June.
As you said, I can't imagine that they're going to want to participate in the funding for this.
Yeah, we because we put everything was on pause, we didn't have the conversation, and I would imagine that you haven't heard anything because there's nothing in their budgets for it. Right. They don't even know what they're dealing with at this point.
And as short-staffed as the mental health department is in general, it's going to be very difficult to try to put together a program that's going to make sense. So I do think we need to bring that back up next month and have a lengthier discussion on that, Michael. And we could come through next month. Good. Okay.
Certainly. The next item, I just wanted to share some good news with you. Initially, after our buildings closed and we, within 3 days, converted entirely to telehealth, we had a rocky first couple of weeks getting reimbursable services to the level that we had been before. But I'm happy to say that year-to-date 2020 compared to year-to-date first 5 months of 2019, we are just something like $3,000 behind in reimbursement, which is quite an accomplishment. I'm very proud of our staff being able to be nimble and convert to these telephonic and video telehealth services, and for our billing staff to bill for them. So we're doing well in that regard. I did want to mention to you that our clinic continues to have a waiting list. It's about 35 individuals who have requested services and we cannot provide them to them. The vacancy freeze is impacting us in a significant way. I'm sure our department is not unique, but I would ask that you reconsider waiving the vacancy freeze for 2 of our staff. We're only asking for 1 behavioral health social worker and 1 behavioral health care coordinator. Both of those generate reimbursement that covers the staff costs. Our caseloads are dangerously high. We have 1 staff due to go out on maternity leave soon that will increase the caseloads even more. We have 2 staff that are eligible to retire. As I said, we have a 30-person waiting list, and we are also defaulting on some of our service contracts. So I ask you to consider that, and if it's at all possible, to unfreeze, if that's a word, 2 of our 10 vacancies.
Any discussion on that?
What I can say, Chairman Ligonia, is that we're going to probably take a look at that, and I'm actually looking at a way of restructuring the request for personnel, whether it be frozen or not frozen. We're going to have to. I think it needs, and I was going to talk to people about this separately, but for at least a temporary basis, I think we need to run these requests through the budget work group, which we will, at the budget work group, we'll start advertising the meetings, and then we'll stream it just like a normal meeting. But I just think because of continuity, we're going to need to, because we're sort of the ones working with the budget on a daily basis, we're going to have to look at these on a case-by-case basis with the committee chairs from their respective committees to be able to assess whether it's doable or not. I mean, as everyone knows, we're projecting anywhere from a $15 to $20 million deficit. We were able to close close to 10 million of it through the actions we took last week, but we still have a budget hole that we have to deal with. So that's, at this point, we want to provide service, absolutely, but we also have to remain solvent as a county.
So, Michael, I just want you to know that I did speak to Matt about it, and as Matt just stated, I appreciate how hard they're working to try to manage this budget. They definitely are cognizant of the issue there, and I would expect that there will be further discussions with no promises. But I know they're doing all they can to try to correct a pretty difficult situation, and that brings back one of my other concerns about the future of the satellites, because to add that to your caseload would be almost impossible. So I would hope that maybe by next month we can have a little better sense of the budget, which Matt would be able to give to us. And in addition, we can then have that conversation about the satellites.
Yep.
I appreciate your consideration. I'm glad I don't have your job.
Thank you, Michael. And I also want to thank you and your staff for the extra efforts in these trying times. And we appreciate how the revenue's been coming in and how hard everybody's been working. It's not going unnoticed. So thank you very much, Michael.
You're very welcome.
Yeah, I would just like to speak up for
Go ahead, Sarah.
the waiting list here, and it seems like this is almost 100% revenue neutral at this point. To wait another month, I mean, there's a lot of people in crisis here. Is there any way to move this forward faster than that?
That would be a question for Matt, and I don't know that Matt would have make a decision in a month. Maybe it could happen sooner either way. But
Well, we're going to be meeting again this week. We're meeting probably anywhere from 2 to 3 times a week, so we can have a discussion fairly soon about this.
Thanks.
And again, we're going to be the work group. We've done a lot of work. We're going to be noticing the meetings moving forward, probably starting next week, and so there will be any supervisor then will have access to the meetings.
Great.
If I may, I'd like to also bring up the topic of furlough. I noticed that our department was not included on the list of carve-outs, and I asked for consideration of 3 dynamics that may influence consideration. This has the prospect of this has concerned me a great deal. For starters,
excuse me, Matt or Chairman's, is this executive session discussion? Matt, unmute yourself.
It should be, yes.
Thank you, Kelly. Is that something we want to go into? We have another meeting at 5 o'clock.
5 o'clock, yeah, just a reminder. So, and this, I don't know if you want to go on with it right now, Matt, or,
Yeah, we can do executive session.
okay, so Sarah, you need a motion to go into executive?
Yes.
Second?
Eldridge, yes.
Eldridge,
Okay, now just give us a minute, Rob, for Oswaldo to disconnect the main feed.
online.
Okay, yep. Oswaldo, if you could connect us back and then let us know. Okay.
I just need a motion to adjourn, and thank you, everybody.
Thank you. Bye-bye.
Thank you.
I need a first.
Can we get a motion? I'm sorry.
Motion to adjourn, Fury.
Fury, second. Sterling, second. All in favor?
Aye.
Thank you, everybody.
Thank you.
Okay, everybody that's on for public safety, just hold tight. I just need to do something before the meeting starts.
Do we have to go out and go back in?
No. Oswaldo, do we need to disconnect and go back in, or are we good? Okay, so hold tight, everybody. I just need to end my recording.